There's an old saying, your fanny or your face. And as a plastic surgeon, I get asked to alter both. But if you had to choose just one, which one would it be?
My wife has a fantastic body, and I hope that she keeps it as she gets older.
As she gets older, I think it's probably more important to take care of her body.
If I had to choose one, I guess the face, because you see the face more.
It's gonna really show in the face if the body starts to go. So I think it's kind of a whole package sort of deal.
Face, you can work with that, look around that. It's not necessary. The body, that's everything. That's the temple.
It is a dilemma because as we age, we do lose volume in the face. Part of looking youthful is having volume, fullness to your face, healthy cheeks. But for a woman who's aging, they want to keep their weight and the rest of their body in check. But if they lose too much weight, where do they see the change that they don't like? In the face. So it's a dilemma. Which one do you keep up your body at the expense of losing volume in your face?
I don't think you need to make a choice. I think that there is a fine line, and if you cross that line and you're trying so desperately to be quote unquote skinny, then you may lose some of that volume. I just think it's one of those things where I don't want people to feel like, okay, I have to choose between one or the other. I think there is a fine line where if you're getting you can be too skinny. You can try to fit this model mold and lose too much volume in your face.
Too much volume, and for those women who are carrying a little bit of extra weight, it helps you keep looking youthful. That volume keeps your skin inflated, less wrinkly, so it's a good thing. But we do have options, and we're doing more and more of that. We're putting volume back into the face. Usually I do that in conjunction with a facelift. I have a first example to show you that this right here is an example of just injections. So you can see that she's deflated in the mid-face and nasolabial lines, what we call the pre-gel sulcus. So in a case like this, we took her own fat from her tummy, treated the fat to make it nice and pure, and transplanted that back into the face to add some volume, and that made her look younger,
that made
better,
quite a difference. That's a great result.
Without a true surgical intervention. But for somebody who's not only lost volume, but their face is sagged, this is an example. That's a pretty dramatic result. The combination of doing a classical face neck lift with injecting fat into the cheekbones and the mid-face, where she lost volume to give her a more youthful look.
Thank you, sir.